Good afternoon, and thank you for joining us. As usual, Paul and I are practicing good social distancing and wearing our face masks that were designed and developed here in the greater Bangor area by our friends over at Intention. But for sound quality, we're going to take those masks off. Now, pass the hand sanitizer over to Paul. We are also joined today by Ben, who's our cameraman. He is also masked and providing good social distancing. I'll start off with a few numbers for you. Currently, there are 6 patients being taken care of within the Northern Light Health System who are positive for COVID-19. 4 of them are being taken care of at home by Home Care and Hospice. 1 is at Eastern Maine Medical Center, and 1 is at Mercy Hospital. To date, Northern Light Laboratory has tested 16,852 individuals, with 382 of them returning with a positive result. I did want to talk a little bit about those numbers. When I report those numbers, those are the actual numbers that happen through Northern Light's laboratory and is all inclusive. This may contradict a little bit of what gets reported out by the state, because as we have visitors from outside the state come in and be tested, if they have a positive case, it's actually reflected in their state of origin and not necessarily for the state of Maine. And so sometimes that's been a little bit confusing and also underreports the number of positive cases that we have been seeing within the Northern Light system. I point that out because it's important for us to remember that while we see those numbers reported from the Maine CDC, there is still concern that there is spread of this disease throughout our state, not just by individuals in our communities, but also those coming to visit us as well. So this is an important reminder that it's important for us to continue to do good social distancing and wearing face coverings when out in public, to wash our hands frequently using hand sanitizer, and practicing good hand hygiene in all aspects. Many of us are quite aware that when we are out in public, we should be wearing face coverings and practicing social distancing when we can't do otherwise and when we need to go out and about. This includes coming into our hospitals and into our offices as well. We have seen an increasing number of individuals who have presented to our facilities who are either ill-prepared to wear a face covering or frankly do not want to wear a face covering while within our facilities. This is a dangerous situation for us, and we need to protect both the patients coming in, our staff, as well as the general public. And so it is a requirement that as one comes into our hospital or if one comes to visit one of our ambulatory outpatient clinics, that we do require that visitors and patients wear face coverings. We will provide masks for those patients who have symptoms, and we need to have an added layer of protection. But we do ask that when you arrive at one of our facilities, you have a face covering ready and will wear it during the entire time of the visit within our installations. So with that, I think I'll turn it over to Paul for some updates in the community.
Thanks, Dr. Jarvis. This week, we saw a generous donation from Girl Scouts of Maine donating a box of cookies to each of our 12,500 employees. Those are being distributed as we speak and is one of the latest community outreaches that healthcare workers in Maine and across the nation have received as a show of support by other organizations and individuals in our communities. So thank you to the Girl Scouts of Maine for that generous donation. In addition, we continue to work through our Northern Light Work Health with area businesses and continue to have concerns shared by businesses in particular about masking. Customers masking, employees masking, and one of the key components to masking is to wear the mask appropriately. And so covering both the face, the mouth and the nose rather. And so quite often it can be seen in our community with someone with their nostrils hanging out above the mask, and that's not providing the protection that they might be intending. So as we're continuing to work with our business partners in our various communities, that's one of the issues that keeps emerging. And so as a general community awareness, proper usage of face coverings is a very appropriate protection for ourselves and others.
Thank you, Paul. Before we get to questions, I do have one more final comment to make. In the early days of this pandemic, there wasn't a lot that we knew about this virus, and there was a lot of confusion, misinformation, and really some people reaching out to our healthcare systems across the state to be given factual, data-driven accurate information. We at Northern Light felt that this forum, where we would have regular media briefings, was a great outlet, and we appreciate the media for being able to, for letting us get our message out, particularly when it was a public safety issue. It's now more than 3 months later. A lot of the unknowns that we faced originally, we know more information about and have put certain precautions in. When we first started these briefings, we weren't talking about face coverings. We were talking about social distancing and hand hygiene. We have evolved to where we know that face coverings are an important part of this preventative measure. But now that we have done this, we have done 18 of these press briefings. We think it's time for us to sunset those and to move on. We appreciate, again, like I said, the media's assistance in getting our message out. We are still here, and we are willing and able to answer questions if you'd like. And so if you just reach out to our Marketing and Communications Department, they will certainly get you in touch with me or Paul or any other of our specialists that can answer questions for you. And with that, we will take questions.
Okay, thank you very much, Dr. Jarvis. And to that end, I'll start with the questions. With only 3 of you, I think you'll have probably plenty of opportunity to get your questions in. Let's do this. We'll start again with WERU, and then we'll go to BDN, and we'll go to WABI. Why don't you start off with 2 questions apiece? If after your 2 questions is done, you feel like you need a follow-up, shoot me a message in the text box, and I'll come back to you for another round. So with that having been said, Amy from WERU, just wait for your mic to be unmuted, and then you can ask your question.
Okay.
Can hear you loud and clear, Amy.
Great, thank you. Dr. Jarvis, you kind of started out with exactly what I was going to ask my first question about, which is if someone tests positive at one of your facilities, or maybe has tested positive somewhere else, but then comes for treatment at one of your facilities, but they have permanent residence out of state. We know the agency is not reporting those or including those in their numbers that they report to the public, but are hospitals reporting those folks to the CDC, even though they don't get included in the numbers the CDC puts out? Are they reported to the Maine CDC?
So thank you, Amy. The question was if we had an individual who tested positive but their home residence is outside the state of Maine, do we still report those numbers out to the Maine CDC? And the answer is yes. We are required to report all test results out to the Maine CDC, as well as our positive tests get forwarded on to the federal CDC as well. That helps in the tracking, particularly because oftentimes there is a lack of data transfer from one state to another, and so there is a repository, and we do report those out. It does become a little bit confusing, and we even see that here in the state of Maine, where individuals may own 2 homes, and it is whatever the primary residence is that gets counted. And we've seen that, and we've talked about that before with a number of isolated cases where a patient may have been tested positive in one county, but then another county got attributed with the positive result. And so it is just the national standard is to report positive cases by the home residence and not necessarily the location where the individual either contracted the virus or is getting care for the virus. But we do report those out daily. Thank you, Amy.
Thank you. And my second question is, when training for a situation like this, a pandemic, which I know public health officials probably train and plan for but never expect is going to happen, is part of that training preparing for widespread non-compliance or denial and how to deal with that? Is there anyone that is their aspect of this kind of crisis to deal with and has any expertise in how to approach that?
So the question was about when we plan for emergent situations, including pandemics, do we also include that? What happens if the general public at large does not follow the advice or, frankly, the law in regards to that, and how do we handle it? So I will say that Northern Light Health, we are fortunate that we have some experts in dealing with sociology and psychology who have taught us how to de-escalate situations. Those are not unique to emergent situations. We are in a very stressful profession, and we deal with some very, very tragic moments, and so people's emotions get high. And so we do have training that we go through. In fact, all Northern Light employees do take some form of training to help de-escalate situations like that, which also helps us then when we are confronted with individuals who who may not want to follow the particular rules that we have. Sorry, we're getting a little bit of feedback there.
Okay, thank you very much, Dr. Jarvis. We will move on to Charlie Iacker from Bangor Daily News. Charlie, you're up.
Yes, hi, thank you, Dr. Jarvis and Paul. As always, appreciate your doing this. So I guess my first question is for Dr. Jarvis. In looking at the state CDC COVID counts, they break out kind of by the age of people, or the rough age, people in their 20s, 30s, 40s, etc. And if you follow those, basically in June, around June 10th or so, the majority of cases, let me just try to explain this right. So before June 10th, the majority of cases were in people older than 50. After June 10th or so, that has flipped, where it's now the majority of cases are in people younger than 50. So I'm going to ask this to Dr. Shah today as well, but do you have any sense is there a way in which younger people are getting infected more, or is it just that more testing's happening, or do you have any other thoughts about what could cause that?
So Charlie, that's a great question. So the question is that we've seen a change in demographics for individuals being reported as being positive for COVID-19 to typically before the month of June, we were seeing individuals who were over the age of 50 who were being tested as positive, and now we're seeing a younger part of our population, particularly those between the ages of 20 and 40, who are testing positive. Two theories on that, and they are theories. First and foremost is the weather is nicer. Young people do like to congregate. We did have celebrations around things like graduation and the like. And so there's that people have just started to get out and about in the community, and therefore you are seeing more younger people who have been in contact. In addition, many of our older residents have taken the necessary precautions to protect themselves, knowing that they are at higher risk for disease. And then the second part of that is that we are doing more testing, and we are testing more individuals who are not as severe disease illness, but still are still manifesting symptoms. And so therefore we will be seeing some people who probably are not at risk for severe disease, but having some more mild or moderate diseases. However, the alarming thing about that, and I'm glad you asked this question, is what we see happening in the rest of the country. So right now we are seeing increased rates of hospitalizations, at least in 3 states, Arizona, Texas, and Florida, of younger individuals. Now, they're not so sick as to require critical care or ventilation, but they're still sick enough to require hospitalization. And that's something, again, that we talk about. Prevention is the key to driving this virus down and keeping our numbers safe. And so while many people think this is a disease that only affects older people, that is not true. It is indiscriminate as to who it affects. And now we're seeing, again, as we see more young people congregating, that they are now being hospitalized with symptoms of this disease. And so all the more important for us to remain socially distant, to wear our face coverings and practice good hand hygiene. Thank you, Charlie. And I know you've been with us since the beginning, so I appreciate that as well.
Yeah, yep. And then the other, I guess, question I have for now is so there are some cases in Aroostook County that we've heard about. There was some Holton EMTs, and I'm not sure how the extent of that at this point, but do you have any window into whether there are any outbreaks happening there or anything like that?
Well, technically they met the standard from the state as being an outbreak. They were a group of individuals who worked together in a close proximity, and the number of positive cases in 2 of the instances exceeded 3, and that's what they consider an outbreak. We have not been able to identify, as far as I know, the actual index case as to where that infection started or that outbreak started, but I do want to commend the staff at Holton Regional as well as the staff at Northern Light A.R. Gould. They did a tremendous job working with the state and working with the agencies that had these affected individuals in identifying it quickly, providing support, and taking care of those individuals. So I'll give a shout out to them. They did a remarkable job.
Okay, thank you very much, Charlie. Just a note, folks, we're having some audio feedback, so I'm going to try and minimize that as much as possible. I'm going to mute all mics when Dr. Jarvis is speaking. So I will probably mute and unmute you in between questions just to make sure the audience stays as clean as possible. Okay, again, thank you, Charlie. Next, we're going to go to Brianna from WABI. Just wait till you see your mic unmuted and then ask your first question. Hang on, Brianna. It's getting a little sticky. There you go.
Can you hear me now?
Yep, we can hear you. Thank you, Brianna.
Hi, Dr. Jarvis. Thank you so much. My question is, maybe you can reiterate for folks the importance. I know that we've talked in the beginning, in the very, very beginning, we were talking about how face masks didn't work. And I think there's a lot of people out there. I see a lot of people, I talk to a lot of people that don't believe in them still. Down in Hancock County at the grocery store, I see barely anybody wearing a face mask. And you were concerns about people coming to the hospital and fighting that too. Can you just go back and say why it is important? And, you know, in the beginning, it was like N95s are the only ones that worked. And now it's like, oh, you should have at least something on there. So can you talk about that again?
Yeah, so Brianna, that's a great question. I think there's still a lot of confusion, and I think some healthcare workers are confused about that. So I'll go quickly over the timeline. So initially, you're correct. We were talking about those special N95 face masks that healthcare workers wear. We know that we use those for specific indications, such as to prevent the spread of tuberculosis when an individual might have TB, as well as what we wear sometimes when we're talking about outbreaks of influenza. Those masks are specifically protective for small particles, and that's what our spread is when we talk about respiratory illnesses. Initially, that was what our concern was, is that we were not going to have enough N95 masks. As we learned more data, we realized that normal procedural masks that healthcare workers wear also are effective in preventing the spread of disease from a patient to a healthcare worker. The concern then came about, well, what about a patient to other people when you're out in the community, particularly because of that asymptomatic patient, the person without symptoms, and we know that they can shed virus as well. And what we have learned is that this particular virus produces many, many particles, many more than what we see with things like influenza. And what a face covering does is it keeps those particles that come out in our normal breath, the fluid that comes out of our mouth when we cough, sneeze, talk, yell, or sing, it keeps that on this side of the mask, so it protects other people from us. And that's the importance of the face covering. It's to protect everybody else, not the person wearing the face covering. And that's where this confusion lays, because initially we were talking about protecting the mask wearer. Now we're talking about protecting everybody else from each other. Because of the fact that we have this asymptomatic spread, which is very different than we see with most other respiratory viruses. This virus will find a way, and this is just one more layer of protection. I like to think of it as social distancing is like putting your seatbelt on in a car. It is the primary way for you to prevent injury when you're in an accident. But secondary to that, we have airbags. Think of the face covering as an airbag. It is an added layer of protection to continue to limit the spread of this disease. And if we think about it that way, it's just as important that we wear the face covering as well as remain socially distant and continue to do good hand hygiene. So thank you for the question.
Thank you so much. And one other thing is maybe cloth. People wearing, I've seen people, the opposite, I've seen people wearing cloth gloves. Are those, is that protective, or is that just passing germs from one surface to the next?
So do you mean gloves on their hands, I'm assuming, not using that as their face covering?
Yeah.
Well, we've seen some creative people with their face coverings, and I applaud them for their creativity, because I don't have that. So the question was, is wearing gloves while you're at work, is that a thing that helps protect us or not? My concern about wearing gloves, whether they be rubber gloves, cloth gloves, or whatever, when you're not in a healthcare setting, is that you tend then to not wash your hands. And so if I was to touch a surface with my gloved hand or my cloth hand that was infected, and now because I'm wearing gloves, I don't wash my hand, I can then use that glove to spread things other places. And that's the concern all of us have. And so that's why there has not been a recommendation that people wear gloves on a regular practice when you're out in the community, because really it probably prevents you from washing your hands, and therefore you may touch your face with that glove, or you may touch other surfaces that other individuals may touch. And so We don't know if that helps to spread the disease, but we certainly know that it can do that, and so we kind of caution not to really wear gloves. We'd rather you use hand sanitizer on a much more regular basis than using gloves. Excellent question, because I've seen the same thing when I've been out at the supermarket or the hardware store. People wearing rubber gloves, and I watch them, leave the store, and they have yet to use hand sanitizer, where really you should be using that hand sanitizer as you enter into the store and as you exit, particularly after you get into your car and take your face covering off.
Okay, thank you very much, Dr. Jarvis. That actually wraps up all the media representatives here that had questions to ask. Before I wrap up, and since there's so few of us, let me just do this real quick. I'll just unmute you and ask you each if you do need a follow-up. Rihanna, do you need a follow-up question, or are you all set?
Nope, I'm all set. Thank you.
Hey, Amy, how about you? Are you all set? Do you have a follow-up question? Oh, hold on, Amy.
Sorry about that. No, I'm all set. Thank you very much.
Thank you. Charlie, how about you?
Yep, I'm sure. I'll have one more for Dr. Jarvis, which is, as you touched a few minutes ago on the sort of resurgence of cases or ongoing surge of cases in some other states like Florida, et cetera. And do you have any sense how does Maine, and again, this is another question I'll be asking the Maine CDC, but I'm curious what your thoughts are. Does Maine have any concrete benchmarks of, okay, if this number gets to this level, we might consider sort of slowing down our reopening or even putting in place reimposing restrictions? How do you think the state's doing on that?
So the question was, does the state have any firm guidance or numbers that they're going to use to determine whether or not they're in phase 1, 2, 3, or 4, or go backwards on the reopening of the economy? I'm not aware that the state has any fixed numbers. I think our governor and her office have done a great job at monitoring the situation both here in Maine and around the country and responding to that, and we applaud those efforts. I don't have any particular knowledge, though, of how they're determining each of those phases, other than that we need to carefully monitor what's going on in a current situation. So with that, I just want to once again thank everybody for joining us over the last few months. Again, if you have any questions or concerns, we are always happy to respond to media requests. So please just reach out to our marketing communications department, and they can put you in touch with one of your experts. Paul and I are always willing to come and speak with you. And so please keep that up. And again, thank you for your partnership over this trying time.
Thank you very much.